like years ago when I first started working at the clinic, I had an older gentleman come in. Every medication we'd ever sent home, he gave it to his dog rectally. Why? I don't know.
I had an owner come in, and he came in because he saw small bugs on his dog. So I put the dog up there, and I'm like, there are really literally no bugs on this dog. He's like, they're right there. They're everywhere. And then he's like, I'm not touching the dog. He goes, because they're everywhere in my house.
When you just said you try to represent and support the clinic and the mission and respect, by doing that and then living them out, I think that's all a boss really could ask for as well.
Hello, everyone, and welcome to another episode of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode or a previous episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, let us know. Sorry, Richard was calling in on that moment.
Oh,
and
Richard.
So I had
he
to,
can sense we're...
I had to decline the... I had to answer it.
He can sense we're doing a podcast.
Richard.
And he's really upset that he's not a part of it again.
Yeah.
This would be his third one in a row.
Oh my God.
Yeah, exactly. I don't know what he was calling about. Let's find out.
I called him Richard.
Let's see what he says.
Richard.
Well, you have to say hello.
Hey, what's up?
Hey, question for you. I am headed to Lafayette in a second, and I've got a question about which chair to take, Holden office chair. The chair that matches the one that's currently in the office is the one that stays here, correct?
He can have whichever one he wants. It doesn't really matter.
Oh, look at that. True motherly care and selflessness.
It's in the basement, so if that's okay, if that's okay with you, I'll just give him that one.
Sure, that's fine. Okay,
Bye,
bye-bye. Bye,
Richard.
Richie. He doesn't know he's on the podcast. Important details, because everyone is moving out of the house this weekend.
Are you excited?
Oh, that sounds kind of sad.
So I know. So Holden is now going to be in Lafayette. He'll be back at the house a couple of days because he's working at Lilly. So then the traveling, but then because Evelyn's starting vet school, like orientation next week, and then Johnny's moving into IU. What is today?
Oh, they're
Thursday.
just going back to school
Tomorrow. Yeah. And then
I thought you were saying like permanently they're
out of here.
Well, I mean,
Holden's
they might be,
off
I
of
guess.
payroll. There's that. So
Yeah.
And then it's just Calvin and Trevor.
Calvin and Trevor.
Yep.
Yep.
Love it.
The last
Living
two
the dream.
standing.
That's right.
This
Exactly.
small fraternity.
It's a smaller fraternity. That's right. You are around. Okay.
Don't forget Harrison.
We just keep adding men to the fraternity, so now the babies are part of it. So.
Yeah, that's true. You
Johnny
should have like
said-
an initiation.
Johnny said we were going to have T-shirts that say Pledge 1 and Pledge 2.
Oh, that's cute.
That's
Get like
really
an
cute.
emblem for your
Yeah,
name. and, like...
because it's dong 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 fraternity.
What?
Yeah.
That's what you call it?
Yeah, because it's all men. So
Oh, yeah.
get
Oh,
it?
you do have it. You have
No, we don't have it like
She said what it's called.
dong dong dong.
yes, and so it is like because it's all men for you know
Yeah.
it's a fraternity. It's all anyway. Whatever. Just Madeline and I. We're the house mothers. Okay.
Did you say reviews?
I did not mention
I
reviews
wonder
before we
how
got
accurate
sidetracked.
we were when we filmed at the lake because we pulled some numbers out of our butt.
I don't even know what we said at the lake.
I don't
so.
either. Okay. Anyway, Apple is at 142 and Spotify is at 374.
Nice.
Remember, our new goal is Spotify at 500. So.
Yes.
Yeah, baby.
Get it there.
Bada boom, bada bang. Okay. Follow us on social media, Instagram and TikTok at the Veterinary Roundtable is our handle. We did some solid content, which we were just reviewing
Yes,
prior to
we
starting this.
did.
And honestly, we think we're hilarious.
We are
Yes.
pretty funny.
And our husbands were laughing with us
Yes.
behind the scenes as well.
They thought we were funny.
and they thought we were cool.
Yeah.
Yeah.
So our
Check it out.
producer just needs to post it. Because I
We
just
did a
watched
good
it and I
job.
thought it was perfect.
We were crying
Yes.
because we thought we were so funny.
The ending did change. We might have double. Ooh, what's that called? We have multiple endings.
Yes.
Alternate ending.
Alternate ending, editor's cut or whatever.
Yeah.
Yes.
We'll do-
Director's
we'll do
cut.
the one,
No, it's director's
and then
cut.
we'll
And then
do
the
the
other
other
one
one.
is,
Yeah.
yeah. Okay.
We had visions.
Yes.
Things to look forward to.
Our visions are funny.
Yeah.
Harrison.
We also have a YouTube channel if you would like to watch our podcast, and that's on YouTube at the Veterinary Roundtable is the page. So
I will say, I know our lake episode's already out by the time you're hearing this one. If you did not watch it, you need to go watch it. Jacob said he watched it.
he might be seasick.
And he never listens or watches our podcast.
Right.
He's a fake fan. But you have to watch it. Have you watched it?
No.
The part where she found the spider out.
I told Harrison, I was like, Tugwall scared the crap out of me, and I stood up like
No, because she's like freaking out, and then she just violently starts whipping.
I said, it was gonna get away.
Well, no, because you and I just sat there and stared at it, and then she grabbed the shoe and started.
Mind you, I can barely lean over nowadays. So
I know.
God.
Harrison needs to make it its own video.
Its
because
own
it
meme.
is so
it
funny.
needs to be a meme.
It is so
You
funny.
did,
make it
Harrison?
his
Okay.
Okay, good, because it is like it's just Keegan and I are just
it
sitting
was
there.
a thick black spider.
Okay. Oh my God, that's
But
great.
don't they need to watch it or no?
Oh gosh, too funny.
I was dying when I watched it. Oh my God.
Okay,
It was
I also hate spiders, and the
Yes.
fact that I had to find it on King.
Yes.
And
I don't
kill
know.
it
I
myself.
just stood up really quick. I didn't even know why I was standing up. I think because she was like,
It's like, oh my God.
It's because the worst thing someone can do is point at you, not
Right.
tell you what it is, and
and
go.
then Courtney's like, there's a.
I know, but like the part that really kills me is you and I just because I hit it off of you. Here's a play by play. I hit it off of you, and then it falls in all the cords that we had sitting on like the floor.
Right.
And then you and I just sit there and stare at it. And Doug was like, somebody kill it.
Oh my God. Okay, let's watch it. Turn it.
Oh
turn
my
it
God.
on.
It's so funny.
Well,
Okay.
okay, Courtney, are you gonna do it?
Okay. Ready?
Yep.
Okay, now it's on the cord. Now somebody kill it.
Kill it, kill it, kill it, kill it, kill it. Step on it.
It's dead. You're not saving all the animals. Not spiders.
Okay, but you have to watch the wide angle of it, like on the actual podcast,
Oh.
because you
Oh
can
my
see
God.
King and I just staring. It was just like you were talking about a case and then
Oh my God,
immediate
it's
chaos.
You never know what's gonna happen nowadays.
It's so funny. Okay,
Well,
anyway.
anyways, that's a good reason to use
Oh,
the YouTube
God.
channel
Yes.
for our podcast, I guess, if you want to get motion sickness.
Also, yeah, because you can see the boat
during some
rocking.
of it, like
Yeah.
the waves hit us, and it was like, "Woo."
But it is a pretty view. There is
Yeah,
a
it's
pretty
very-
view out the back.
yeah.
of the
Yeah,
boat,
most
so.
of our podcasts aren't fun to watch, but that one is a good one to
Yeah.
watch. It's funny.
We had a good time.
All right, I'm Dr. Emily King.
I'm Courtney Allen,
I'm Dr. Ashlyn Duckwall.
and you're listening to the Veterinary Roundtable. If you didn't get that yet,
Mm-hmm. Welcome.
Okay.
Welcome.
Pits and peaks, folks.
Mhm.
Well, my pit was I had to chug a lug a glucose
Ugh.
drink today. Even just thinking about it.
Makes you gag.
Because I had my glucose pregnancy baby appointment. But I don't know. And the positive, the peak is that I went and got ice cream afterwards because I don't know if I'm diabetic yet. So,
Consume all sugar now.
yes.
Mm-hmm.
Yeah,
Yes,
that's where
that's
I'm
what
at
you're-
in my life. The next
Yeah.
12 hours of bliss.
Mhm.
24.
Before you find out.
Yep.
What about your peak?
Her peak was
my
she got
peak was
ice cream.
cream. I went
Oh,
to
the
the
peak
Dairy
was
Queen.
the ice cream. Okay, I got you.
She got ice cream after her
I
appointment.
did not get a blizzard. I got a twist dipped in chocolate cone.
But that sounds delicious.
Twist
It
and
was,
dip.
it was really good. It went
You know,
by
you
really
can't
fast.
beat Dairy Queen. It's still like,
I know.
Jacob and I
Like-
went there on Sunday night after we got home from the lake. We were just sitting on the couch. He's like, "You want to go get ice cream?" I was like, "Sure."
Handel's too. Oh, it's too far away
Yeah.
though, but I love it.
Did you say Handel's?
yeah, she did.
Isn't it handles?
It is.
I thought you said Handel's. It's just handles.
That's like the bougie version. You guys
Handel's
want to go to Handel?
in Carabel,
Get
Indiana.
some caramel. Get some chocolate ice crema. The creme de la creme.
I wasn't going to say anything, but you,
Oh,
brought,
I
you did it.
was.
You said it. Yes, that's
Wow.
amazing.
Is that how you
It's got
At
really
500
good. Yeah, that's
Spotify
how Charles
reviews.
says it too.
At 500 Spotify reviews, we'll go to Handel.
We'll go to Handel's. We'll try to find Handel's and Carmel.
I really want to call Charles right now and say, "What's that ice cream
We
spot?
will.
Caramel and Suey?"
Oh, God. That's
Okay, let's
amazing.
do it.
Can you call?
Hang
No,
on.
you want me? Yeah, you call
Ugh.
him and say, "What's that one ice?"
I'll be like, babe, I am
Oh,
Let's do it.
goodness.
I am blanking. I really need you to help me. Hey, quick question. It's driving me insane. What is that ice cream place in Carmel right by the Buffalo Wild Wings that we like to go to? It's local. What's it called?
Handles.
I told you. I'm gonna pee my pants.
Thanks, babe. You just made our podcast way funnier.
Is it handles?
Oh gosh.
It's Handles.
Charles trying to sound rich.
I just said Handles, and they are laughing hysterically. I was like, Charles says it too, and so then I just called you.
Oh my gosh, that's amazing.
Oh, okay.
What do you say?
Gotta go. Love you. Bye.
Oh gosh, that's too great.
You're gonna have to cut that out. He said it's our Jewish heritage. We're
Oh,
not Jewish. God, why has he got to ruin it? You can cut that out though.
Oh my
Okay.
God. That's good
Okay.
stuff. I'm gonna
Jesus.
start
Sweating
calling it
now.
I know.
Oh, that's too funny.
Thanks, Stockwell, for the laugh.
Yes,
I
that was
told you
great.
that's how he
That was
says it.
amazing.
He said handles. Anyway, okay.
You guys go.
My pit is. Oh, let me do some more complaining. How many x-rays I've taken in the last 2 weeks? I was going to add them up before I left the clinic last night, but I didn't get off till like 7:30 again.
Yeah, you're glowing.
Yeah, I know. And
From
radiation. I was going to take count up how many I've done, but I've done at least over 30 x-rays in the last 2 weeks.
Oh my
if not
gosh,
more.
you've had a bunch of sick animals.
Yeah. Which, like, I don't hate taking x-rays. It's definitely not my favorite thing, but just doing it like one after another, it's just very time consuming, especially if you have to sedate them. And so it's just annoying to me.
Yeah,
It's one of my least favorite things I do at work.
That's good to know.
But, well, I'm still going to do it. I'm going to do it. I just don't like doing it. I don't know. It's just not my thing.
Yeah.
I don't like it. But anyway, I'll still do it.
Okay, great. You kind of have to because I don't.
Right.
I can't.
Yeah. And then my peak is my best friend's bridal showers this weekend.
Oh, fun.
Yeah,
Those are
so that'll
fun.
be really fun celebrating her. I'm really excited. So hopefully the weather is nice because it's outdoors.
Nice.
So
Nice and hot.
yeah.
Very cool.
Mhm.
My pit was that the boys are going back to school, and so then there's less chaos in the house,
Mm.
which is good, but then also bad because it's fun having everybody around because their conversations are hilarious. So that's, happening. And then my peak is probably that we had such a great time at the lake weekend.
Yeah.
I love having people up there. I love sharing it with everyone. And it's just so fun to have like uninterrupted time to like sit and visit and hang out.
Yeah.
And so it's one of my favorite things to do with people. And so, yeah.
It was everybody at the clinic yesterday or the day before asked me, they're like, do you have fun? I was like, we had too much fun.
Yes.
It was so fun.
It
The
was so
golfing was
fast.
I'm so
hilarious.
sad
I
it was-
think that
it's
is the most
over.
time I've spent at one time with the golf simulator that night. Like that was so much fun. It was just like
Was
there were so many parts about it. It was just great.
Yeah.
It was just a big, everybody
So-
make fun of Corny's golfing night.
Yes.
We were crying, laughing on that day too.
Uh,
Oh goodness.
we'll do it again.
We'll do it again.
Same time next year, just more.
Longer.
Yeah.
Yeah.
More time.
Okay. This, I guess, is my other pit. We don't have a Tales from the Trenches this week. So it is a newer segment where we want our listeners to send in their most ridiculous, funny, unhinged stories, and then we read them on the podcast. You can send your stories to the Veterinary Roundtable at gmail.com, and when we read them, it's our first time reading them too, but I'm kind of sad we don't have one.
Well, and
I look
they can
forward to
be
it.
just, weird stories. They don't
Yep.
have to be like funny
They don't have
necessarily.
to be super dramatic.
They can just
or-
be
something
interesting
crazy.
things that you don't see, like that
Yeah.
are happening to you in the veterinary world.
For sure.
So, because we were joking around about some of the things we've seen, so anyway,
Our stories weren't as elaborate as the ones we've read,
Yeah.
but
Well, let's say them. They're short. My one was just had an owner put compounded prednisolone in an ear that was supposed to be given orally, but they thankfully stopped at that and did not put the ear meds in the mouth. So that was good.
because you think they confuse the two.
Yes.
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 Yeah.
Mine was like years ago when I first started working at the clinic. I had an older gentleman come in. It was actually on a Saturday when we had Saturday hours, but he told me, I don't know how we got on the topic, but every medication we'd ever sent home, he gave it to his dog rectally. Why? I don't know.
That's what you're supposed to
Suppository.
do. It's a suppository. Oh my gosh.
Can you imagine
Yeah.
on a label, please give in the butt.
I know, right?
Twice a day.
Yes. My story that I was telling them about was a long time ago, several years ago. I had an owner come in that was a young gentleman come in, and he came in because he saw small bugs on his dog, which would not be too unusual because
Mhm.
you know, when the
Fleas.
receptionist hears that, yeah, exactly, they're thinking fleas. And so he comes in and they put him in an exam room. And when I go into the exam room, he starts talking about all these bugs that are on his animal. And at first he sounded very logical and, you know, didn't seem too suspicious of what was going on. And then I'm like, well, let's take a look at your dog. I thought maybe he was having some, you know, other kinds of issues or whatever. And so I put the dog up there and I'm like, there are really literally no bugs on this dog. And so I was like, can you show me what you think you're seeing? And he's like, they are right there on the dog. And I was like, can you just point though to me? Because I just don't think I can see them. I don't have the best eyesight where, you know, I'm just not seeing them.
Mhm.
And he's like, they're right there. They're everywhere. And then he's like, I'm not touching the dog. He goes, because they're everywhere in my house. And he was wearing gloves when he came in. And so I was like, okay, so you think there's bugs? He's like, there are bugs everywhere in my house. They're all over my dog now. I need you to fix this because they're everywhere. And I was like, okay, so as he keeps going, I was like, okay, there is something going on
Yeah.
here that is unusual. And so then I'm like, okay, what is happening? And so I step out of the room, and then I don't know if I was talking to someone else, and someone else was like, or, you know, when we were talking about the case, I was like, something's going on with this person. I'm not sure.
Yeah.
And they were like, well, you know, people on Met see things. And so I was like, oh, geez. Okay.
Drugs.
Drugs. Okay. So this person might be on drugs. And so then I was like, oh, crap. What do we do? How do
Yeah.
we help this
Yeah.
person get, like, you know, do you let them leave your clinic? What do you do?
Yeah.
You know, when you're in this scenario? And so I said to, because he was talking about his apartment, he was like, I just can't clean them up. I don't know what is happening. I can't get rid of them. And I was like, you know what? Let's call your parents, because then we can get help to clean up the apartment while the dog is here, because I really just wanted to call someone. And so then he was like, oh, that's a great idea. Let's call my mom. So then I called his mom, and I was like, okay, I don't know how to talk about this, but this is what's happening.
Kids on drugs.
Yeah. And she was like, oh my gosh. And this is why you say something. The lady was so nice. She said, oh my gosh, I can't thank you enough for calling me. He's been running with the wrong crowd. And we were suspicious that something was going on. And this tells us now that we were right.
Oh, wow.
And so I'm coming. can you just, and I was like, yeah, of course, you know, like whatever.
Yeah.
And so then she ended up coming and getting him and taking him, you know, wherever she took him.
Did you talk to the mom in front of him?
No.
Okay. Yeah. I didn't.
No, I stepped out of the room.
Yeah.
And he went with his mom. Unfortunately, he ended up passing away. Like
That same day?
No, 6 months.
Oh.
6 months later, his mom ended up sending a card and saying,
wow.
Oh, wow.
I wanted to thank you because we did get him straightened out, and then, you know, like, and she had a story.
Aw.
Anyway, it was really sad. But at the same time, I was like, okay, that's why you say something.
Mm-hmm.
Well, you saved him an extra 6 months, probably.
Or however, I can't remember
Yeah.
exactly how long it was, but yeah.
Oh,
Yeah, it was sad, but it was like, oh my God, I've never been around.
Right.
That's what it was.
you don't
just,
know what you're looking for.
No, and it was
Yeah.
just so interesting.
Yeah.
Like everything about it was so interesting. Anyway.
That's a really good tale from the trenches.
Oh, thanks,
Yeah.
man.
That was
Yeah.
fun.
Okay, well, not funny, but
Well, no, but
Well, no.
Interesting.
It doesn't
not
have
all
to,
of them are anyway.
It doesn't have to be funny.
yeah.
Okay, case collections. So we alluded to it. Was it on one of the late podcasts? But I have a really interesting case. So there's a household of 2 dogs. One is a Samoyed 6-year-old male, and then the other one is a 6.5-year-old female spayed doodle. And they were both at the histories. They were at boarding 2 weeks prior. The one Samoyed, he had to go to the ER because he came down with pneumonia. They did x-rays, they got the diagnosis, whatever. So I was seeing him for a recheck. Well, they brought in the female housemate because she had started to like cough and gag. So they were worried she was starting to get pneumonia, which made complete sense. So on his exam, I started with him. They said he was doing good, but then that morning he didn't want to eat, which is abnormal. He had vomited. And I found out the ER had only sent a week worth of oral meds home, and they only sent home a lower dose than what I usually do of Clavamox, and they did not send home to continue Baytril orally. He didn't have a fever. He was BAR. He was anxious, but his lungs sounded clear, and there was no nasal discharge. He didn't cough on tracheal palpation, no effort breathing. So I said, okay, let's just go ahead and continue meds, higher doses. I'm adding in oral Enro. We're going to go longer, and then we'll plan on rechecking the x-rays as normal and go from there. So they were fine with that. We did Serenia too. Then the female housemate comes in, and I noticed she didn't have a fever. She was BAR. They're both really good dogs. I noticed on her lung sounds, it was very interesting. They were really loud, like very like rubby, harsh, but no crackles or wheezes. Like I could hear everything just fine. She had no nasal discharge. They just said that she had been hacking a little bit. And whereas him, the Samoyed, like he was harder to hear because of his fur. Like I got 2 different stethoscopes, and I was like, okay, I can't hear him as loud, but whatever. I don't hear anything concerning. So I went to the owner and said, well, it could be the start of it. It makes sense, literally, with the whole picture. We could do x-rays as a baseline. We could start with meds because she doesn't have a fever, nothing like that, and then reevaluate. And they're great owners. And he's like, let's get a baseline. Like, I don't think he wanted to have to go back hospitalization. I said, okay. So we got the baseline x-rays, and there's pleural effusion. There is no pneumonia. There is fluid in her chest.
No.
And I was like, what is happening? It was completely off course. And then there was potentially in the mediastinal space, like, is there something like lymph node enlargement? Is there not? Couldn't really tell. She, this whole time, had no dyspnea or anything. She was just panting. She was BAR, pink, everything. Pulse ox was fine. So I said, okay, well, we've got a couple options. We can pursue stuff here, or we can go through ER in case she starts to decline, or sorry, not ER. I can refer you out. And then, because she had actually been to a referral recently for chronic vaginitis. So they're like, well, let's start and let's see what we can collect here. So we started with tapping her. And unfortunately, the pockets of fluid was bloody discharge, like bloody fluid, like a little diluted down bloody fluid. And I knew I wasn't in the heart because I used an ultrasound to start. I don't remember. I think we got 80 mils total, but we had to go back a second time and whatever. So anyway, I was like, well, that's not a good sign. So while we were there, I fast scanned her abdomen, and there's a huge mottled Swiss cheese looking mass thing in her belly. So our original plan was to do a fluid analysis of the chest fluid and submit the x-rays. But when I did that, I called and I was like, no, let's just not submit x-rays. Let's not even submit the fluid in the chest yet. Let's run full blood work, ruling out ITP, making sure there's no history of toxin, things like that. And then let's do an ultrasound. So they agreed. The full abdominal ultrasound was this gigantic mass that was in the mesentery and liver and maybe up to the stomach. It was hard to say. Lymph nodes were enlarged. And let's see what else. The blood work was boring. Chemistry was fine. The platelets were fine, which is what I was looking at. She wasn't anemic. So we actually FNA'd the mass via ultrasound guided and did images quick result come back, and came back as lymphoma.
Wow.
Yeah. So that took a turn.
And there were no other, it was kind of like she's been fine. Now she's just been hacking.
And the hacking wasn't even consistent. It was just on and off randomly.
Had the dog been or were there any other clues where when you looked back, you were like, oh, this is interesting? No
Literally,
weight loss, no nothing.
Even the owner said, they're like, if their other housemate had not had pneumonia and gotten sick,
they
probably would have not even said anything. And then She would have come in on emergency for not breathing and all that stuff.
Yep.
They even admitted it. Like, they were like, wow.
Jeez, that's so
Yeah.
weird.
We were all pretty
What
taken
kind? What
aback.
she's a
Yeah.
what kind of? She's the doodle.
She's, I think, a Labradoodle. Not
Labradoodle?
A golden.
Yeah, she's
Dang.
a Labradoodle.
Yeah. So then they're like, oh, is the vaginitis tied to this? I mean, if her body was like fighting and focused on something else, I don't know. I was like, maybe not. But we decided to, well, I gave them all the options. I was like, honestly, the one thing about this case that will influence our time and our choices is how quickly this fluid builds back up in her chest,
Mhm.
because that's going to be the end all be all probably. So they went through all the options, all of our chemo options, and they decided we're going to submit the FNA of the mass to Colorado State for flow.
Okay.
So we know if it's B cell or T cell, and that influenced whether or not they pursue CHOP.
Oh, okay. So
Full
they
chop.
might think about it.
Well, we have the result. Like,
Okay.
what we got Colorado State back, it was B cell,
Okay.
which was also surprising.
Especially because
Dr.
she's
Dudley-
younger.
Yeah, we
Yeah.
thought it was T cell, and I was like,
Yeah.
not going to be good. It was B cell, and they started CHOP yesterday.
We did our first round.
So you
of
did her first
Christine.
round.
Mhm.
Okay.
And even when I started pred before we even had the answer. And even within like a couple doses, like I scanned her chest before starting vincristine, and there was no fluid in there, which who knows, maybe it just didn't build back up.
Right.
But she had come back last week on Thursday. I saw her Monday. She came back Thursday, had to get retapped, and they got 190 mils off.
Wow.
And
Mhm.
yeah, so we were like, okay.
Yeah,
but
this
then we
is-
found out that day it was B cell, so they still want to just go through with CHOP. So
Wow. That's crazy. That's great.
yeah.
I mean, she'll get some good time. I would
hope
think
so.
Hopefully out of the
it's
CHOP,
really,
especially
I
since
think,
it's B cell.
I was gonna say, I really hope it's really just that fluid buildup. Hopefully that we can.
Keep it bay.
Yep.
Mhm.
Wow.
Isn't that crazy?
That's a cool case.
Yeah, it was very, very interesting.
You know, we talk about it all the time where cases come in like, and they're not there for their original purpose, you know, or like coming in with another pet, or
Yeah.
they come in for something else and you find something else.
Mhm.
Like, I mean, like, I feel like it happens all the time.
Oh yeah. I mean, I'll be honest. On my radar, I was very indifferent to X-rays. I was like, we can do them, like just to have a baseline. But I even was like, it's okay to wait and do.
Yeah.
Yeah, like
Well,
conservative
nothing
therapy.
indicated
Yeah.
that she needed
Antibiotics.
X-rays.
Yeah. It literally. I was like, wow. I didn't have any reason.
Yeah.
Yeah.
And then, of course, I got another case that's similar to chest and stuff, which I'll save. But then, of course, that next day, I have a case of a coughing dog, but their exam influenced me saying, no, let's do chest x-rays. So
Right.
it's just interesting.
It is.
Yep.
Wow. That's
know.
cool.
Yeah.
Cool case. Well, it'll be interesting to see what happens with him
Mhm.
over the next 6 months.
19 weeks.
19 weeks.
Yep.
Yeah.
That's how long CHOP
Last
is.
time we did it, we were just saying we got a little under a year for that golden, but he relapsed. too,
Teddy.
So
If you've been listening to for a while, you
Yeah,
know who Teddy
Teddy.
is.
Yeah. Well, and we've used CHOP protocol because it's so user friendly.
mhm.
I really do feel like that. Like, as out in private practice, as general practitioners, I feel like it's something very doable
Mhm.
that we can offer clients.
Mhm.
I think that the side effects are minimal as far as to the owners, to the pet,
Yep.
to the staff. Like,
Yeah.
if you do everything properly,
Yep.
you can really make a difference. You can save the owners money. You can improve the quality of life.
Yeah.
And we'll see them go out like to that, like to a year, and then relapse. And then sometimes people will rescue them, sometimes they won't. But it's really a great thing to be able to do. And I think so many people feel like it's like the FHOs. Like, people are like, I don't want to do it. No, you can do this. This is something
Yeah.
you can do.
Yeah.
You just need to understand the drugs, and then what the harm, like how
Have
to
the
protect
proper
yourself,
tools.
the proper
Yep.
tools, which I really don't feel like are like cost prohibitive to a clinic. Like, I feel like people can, if
we
you
just
have
order them as needed. It's not
Yeah.
like we have them on stock.
and if somebody has an interest in it, it's a great way for them to form a niche at the practice,
Mhm.
because now they can become not an expert, but knowledgeable about that
Yeah.
particular facet of care that then
Yeah.
clients can take advantage of.
And we're
Like, you've
going
done
through-
enough of it to, I mean, like, to understand it. And
I'm
Yeah.
me and another tech are the go-tos for chemo stuff. 'Cause
Yeah.
we're the only ones that have done it.
yeah.
Well, and the protocol I use is I've gotten from an oncologist, so it's not like I'm just willy nilly,
Right.
looking up plums or anything. I'm going based off what an oncologist said the proper protocol is. So
Yeah.
you have that resource.
Pretty legit.
Yeah, you just keep.
Well, that's
going.
one of the cool things with being with SVP is they have the oncologist. Did you use the oncologist?
Yes,
That's
yeah.
yeah. I mean, she's awesome because you can
Mhm.
send a case in, and then she can offer an opinion, which again is a huge advantage to owners.
Right.
like that did not cost the owners anything, right? So like you got the privilege of
When I even use it from Teddy because I was like, well, they're both in the chest, like so you just kind of put that away and use it for another day. So
yeah, I mean that's just it's so cool. Yeah. So anyway.
Yep.
Okay. Do you have a case or are we gonna move on to questions?
I have a case.
Okay, let's hear it.
Okay. So I just have a note to reference. So we had a 10-year-old just like pity mix come in. She kind of looked like a little land hippo. But she came in on Tuesday for prolonged coughing. So she was in June, I think so mid-June, and saw a different doctor for coughing that had been going on for a couple days. It was constant, and then it was productive with like a pinkish tinged phlegm. She was kind of lethargic, but otherwise was doing pretty good. So Dr. Faust had initially saw her. Her exam was pretty good, other than her lung sounds were slightly harsh on both sides. But she didn't have any kind of nasal discharge or anything like that. So the owner at that time, so Dr. Faust had talked to her about doing the chest x-rays just to see what was going on. And they declined those and decided to treat conservatively. And so they did doxycycline for 7 days and cough tabs for 3 days. And then said if she doesn't improve or she worsens, you do need to come back for chest x-rays to see what's further going on. Well, after that, the owner, we didn't really hear back about how the dog was doing or anything like that. So then fast forward about a month or two, she called again and said the cough was back and it was worse. And the dog was now coughing up pretty much straight blood. I mean, it was still pink tinge, but there was more blood present when she would cough. And she was really, really lethargic, and she was having a hard time even going outside to go to the bathroom. Like, she would get winded. They were having to carry her in and out. She was not able to go upstairs because she didn't have the energy. She wasn't eating. So I told her, okay, next step are chest x-rays. So you need to come in so we can do those. So she brought her in. Getting her into the clinic was very difficult because she had literally no energy. Like, she got so winded. We picked her up out of the car. She's like 80, 90 pounds. Like, she's overweight too, which doesn't help anything, but getting her to the door was hard. So I got her along. I got her to x-ray somehow, but she walked there for me. And then we took the x-rays, and as soon as I took the first lateral x-ray, it was not good. So she actually had a gigantic mass in her chest, like huge. So I don't know if that was the primary cause of like her initial coughing and it was there and then had just worsened, obviously. But yeah, we found that mass. It was not good. Her prognosis was not good. So the owners decided to humanely euthanize her. But that was also a really hard case because the owners were having a really hard time navigating the loss. So the dog was originally owned by the mom of our client. Okay. So she had the 2 dogs, and then she moved and downsized homes. So then she gave the 2 dogs to her daughter, who we see the daughter usually. And she's older, but they brought the dog in together. And then we had told them what the chest x-rays looked like. It wasn't good and that euthanasia was recommended. So then the daughter called her husband so that they could bring the other housemate to see the dog. And then they were talking about it. And then it was just really hard. And we had to talk through everything with them a lot to try to get them to like know that they were making the right decision for the dog because she wasn't going to recover from it. And so it was a 2.5-hour euthanasia. And Dr. Pulse and I were just going in and out of the room, trying to help them. And so it was just a lot.
It's really hard, I think. I mean, and how many times have we seen this where owners don't even have that on their radar?
Mm-hmm.
You know?
Exactly.
And so then it feels like a light switch to them.
Yeah.
Like, but what do you mean you're telling me that my pet's on its last leg?
Right.
You know what I mean? Like,
it wasn't on my radar.
You know, like, what do you mean? Like, we're going to have to euthanize the dog? Like, it was fine yesterday.
Same thing with the case I just shared. They were like,
yeah.
I thought we were just coming in for a little
Yeah.
cough.
Yes, like the blood tinged discharge or whatever is concerning, but like I told her, I was like, we may just need another few weeks of meds. Like, I don't know, let's just do the x-rays just to make sure we're not missing anything. And then when I looked at that x-ray, I was like, oh, well, That's not pneumonia.
Yeah. Well, and the worst ones are the new client ones
Mm-hmm.
Yes.
that come in that way because you have no like previous history of any kind of relationship built with them.
Yeah.
Yeah.
They have to believe that you're telling them something horrible.
Yeah.
And I think that everyone at the clinic does such an amazing job from the very beginning, fostering like a relationship of trust and it starts from on the phone
Mm-hmm.
because otherwise you couldn't get people to follow these kinds of recommendations.
Yeah.
Like it's just, it's impossible.
And taking the time to
Yes.
explain things.
Like
Yes.
2.5 hours. Who's
Yes.
going to spend, do you know what I mean? But
Yes.
that's what you need. You need to not rush them.
Right.
Yes.
Yeah.
And I think that's why people give you guys so many compliments from the standpoint of like, well, we were here just for euthanasia, but now we're bringing our pet back here,
Right.
you know, our next pet back here,
Mhm.
you know, because it is so important to
Yeah.
not rush through those things.
That happened yesterday. We had a new client come in with a stray cat he found, and we ended up euthanizing it. He feeds a lot of stray cats, but we ended up euthanizing the cat because he didn't have the funds to work up something, and it might have not been fixable. But I walked him out to his car because he was taking the cat home to bury it, and I walked him out, and I was like, "It was really nice to meet you. I'm sorry it was under these circumstances." He's like, "Oh, I will be coming back with my other cats."
Yeah.
He's like, "You guys are awesome." So it's
Yeah.
cool.
That's
We
really
made an
cool.
impact on him.
Yeah.
That's such
Try.
positive affirmation and feedback to,
Mhm.
you know.
Worth the time.
Yeah. I mean, absolutely.
Yeah.
Makes such a difference.
Mm-hmm.
Okay.
Those are heavy cases.
Yeah, good
No.
job, guys. Those are great. Those are great learning cases. Oh my gosh. Okay, listener inquiries.
Yes, I think so.
Your text message thing.
Oh. Can't forget the text message feature for our podcast. So you'll tap on the episode and your podcast provider. You look at the top, it'll say send us an inquiry through a text message here. You click that and you can send us a message. If you do send one, if you want to be if you want a shout out on the podcast, you have to include your name. Otherwise, it comes through as anonymous. And we are now taking voice message inquiries. So send those voice memos to the veterinaryroundtable@gmail.com.
Yeah, and that last one was so
Yeah,
cool.
we
Yeah,
only
so
had
much
one
fun.
so
Hearing
far, but
someone's
it was
voice
awesome.
is so cool.
Yeah.
Yes, it was much different than us just reading them.
Yes,
Yes.
please call. It is
Yes.
so cool.
Yes, it is really, really cool.
All right, first one. Are you guys ready?
Yep.
Mhm.
Okay. Hello, Veterinary Roundtable. My name is Kaya, like Dr. King's pup, and I'm writing from Boston, Massachusetts. I'm currently working as a veterinary technician, and I'm also a certified veterinary assistant. I just wanted to say how much I enjoy listening to your podcast. I usually tune in while driving to and from work, and I really appreciate all the different topics you cover. A few months ago, I was searching for a great veterinary medicine podcast and hadn't found the right fit until I stumbled upon yours. I love hearing the personal pet stories and learning about the treatments you use to help them. I do have a question for you all. What is your absolute favorite dog breed and your least favorite? And the same for cats, your favorite breed and your least favorite. Thank you for your time and care you put into each episode. I hope you all are having a wonderful day, and I'm looking forward to hearing your answers. Kaya.
We've definitely probably talked about this before.
Oh, gosh. Your
I wonder
favorite
if-
and least favorite.
I wonder
Okay.
if our hardcore listeners could guess.
Nah, no kidding.
I know.
Because we've mentioned it.
We
Okay, we're
definitely
giving
have
you
this.
10 seconds to guess.
But you only get one. You can only pick one.
Yeah, just one.
Yeah. It's going to be hard for you.
It's going to be very hard.
Oh,
for me.
I got mine.
In the least category. No, I'm just kidding. Okay.
You want me to go first?
Sure.
Sure.
Well, my favorite dog breed is pit bull.
Okay, I was going to say.
What? Is anybody shocked?
No. Did you guess that, listeners? Okay.
I love their square heads. There's something about a pit bull, the way they look. Oh my God, they're so cute. They're like little babies to me.
Yeah.
I love them. I love them so much. And if you ever get me fired up about pit bulls, it's scary.
They're
Okay.
very cute.
What's your least favorite?
My least favorite dog, like look wise,
I was going to
just-
say the whole gamut.
The whole gamut.
okay.
The whole
Personality, I think, is more
kit and
important.
caboodle.
But I guess it's
my least favorite. That's really hard. There's a lot.
I know, right? That's what I was saying. Yeah. Okay.
Maybe
go
we should
based
say our
on
favorites first.
Go based on go. Okay, you want us to go around to favorites first?
Yeah, let's
Okay,
do
now
it.
I'll give you time.
Yeah,
to
give
think.
me a second.
Okay, so my favorite is probably going to be Dachshund.
I thought you were going to say that.
Yeah.
Yeah. The thing I don't like is I had to clean the teeth so many times.
Yeah.
So many dentists.
So many dentals, but I just really enjoyed the personality
Yeah.
and the devotion and the like I just thought it was really cool.
Yeah.
So
I would have to say I'm definitely torn, but if I have to pick one, I think I have to. I don't know. I keep going back and forth in my mind. I think I have to go with the Great Pyrenees
yeah.
over Bernese Mountain Dog, but they are extremely, hence the type of dogs I own, but they're extremely close together. But if I have to pick one, I have to say I probably lean more towards the Great Pyre because of their just slightly toned down personality from a burner.
I'd buy that.
Yeah.
Yes.
And
Yeah.
that to me, that toned down just enough is what makes them
Slightly
more
better.
for me.
Yes. I would agree with that. I think
Yeah.
that's a good assessment.
Yeah.
For sure. I would pick that one over the other one too.
Yeah.
Yeah.
Coloring wise, I think the burner is so cute.
Yeah.
Yeah,
But
for sure. Yeah.
Anyway.
Okay, I
Okay,
think
least
my
favorite.
least favorite, and this comes from, I think, at the clinic, but like the little Maltipoo, Cockapoo,
Mm.
Maltese. There's some, like, this is going to sound really harsh. I don't get the appeal. I think they're ugly.
Well, old
Like, they're not-
Malteses
No,
are you think
like
even young
like
Malteses?
puppy, like Cockapoos and stuff. I can't, they're not attractive to me.
Yeah.
Okay.
Like, I just don't find them cute. Like, she'll come out of her room and be like, hey, and I'm like,
It's okay.
like, I don't know. I don't see the appeal. And then, like, holding them for treatments, they're way too wiggly. I feel like I'm going to break them.
Mhm.
Like, there's no good way to hold them. And when you try to get blood, you probably poke something you're not supposed to poke because they wiggle. And
Yeah.
then when they scream, it's ear piercing.
Yeah.
And they don't age
Screams.
well. And the eyes
Yeah.
are crusty.
Yeah, you're pretty much summarizing every teacup. Like,
Teacup breeds. Maybe that's my
Yeah.
thing. I don't like them.
Yeah. Okay.
I'd buy that. Yeah,
Yeah.
for sure.
Sorry. If you
I
like
mean, I
teacup
feel like
breeds.
we're all gonna have to apologize, but it's our own opinion. But
Yeah, we can have our own opinions.
yeah.
That's what makes the world go round.
Oh gosh. My least favorite breed is probably like a oh gosh. I mean, like you said, it's hard to choose.
Because we also see them in settings that
And we also
are
see
just, like,
good ones
stressed
of the
or-
breed.
yeah.
extreme.
Yeah.
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 I would say I saw like two, and both of them were bad. Are the shepherds that are the police dog shepherds?
Oh.
The
Malinois?
Malinois?
yes,
Yeah. Okay.
That's your least favorite?
yep,
And why?
because they were meaner than snot.
Yeah.
Yeah.
Like you could not get near them.
Yeah.
Like, it was hard to get even in the exam room.
Were they actual police dogs?
No.
Oh.
No.
Yeah, I think any mean dog it's on the list.
Yeah.
No matter what breed it is, if they're mean
Yeah.
and unpredictable.
And I was like, you're just not cute, and you're mean. Like, okay,
Yeah.
Yeah.
that's
okay.
right.
I'm trying to focus on like what I really wouldn't want in my house. That's
Okay.
what I'm trying to focus on.
I thought about that
okay,
too.
Okay, yeah.
Because I think, like you said, like we've said, we see the good and the bad, and like of
Mhm.
course, if we see them as puppies, they're cute as puppies and whatever. So I honestly would have to say the English Bulldog.
Okay. See, that was on my list too.
I know.
Yeah.
I thought bulldog or brachycephalic in general, but
yeah.
It was either that or a
Mhm.
pug.
Yep.
And it's,
Oh, I should have. Yeah, pug is a great one
Yeah.
to pick. See, they're just.
and
yeah.
it's just because in my household, like I would not be able to withstand the snoring, the snotty, like the,
yeah.
and then like pug more than a bulldog, but they're just kind of sometimes all over the place, and
Mm-hmm. The drool.
They all get diabetes.
they all have bad skin. That's the other thing is like
Bad
I
skin,
wouldn't want the
yes.
skin issues,
And they
like,
smell.
and they're not even. I don't think they're. Sure, we have the occasional mean one, but like I
They're
don't even
pretty
think-
nice.
Their
They're pretty
temperament's
nice.
pretty easygoing.
Yeah. So it's not because I think they're mean or scary or anything. It's all the other facets that I just would not personally want to own one.
Yeah.
Yes.
That's how I'm going to approach that question.
I would not want to own a barking breed
Yeah.
either.
Yeah.
The other
Like
reason
a
from
schnauzer
Yes.
or a beagle.
Yeah.
yes,
Like I love beagles, but oh my god,
they're
no.
so cute, but they're
Yeah.
loud.
Oh my god, so loud.
And I think bulldogs and pug puppies are some of the cutest
Oh
puppies.
my
Oh
gosh,
my god,
yeah.
pug puppies.
Like legitimate, the
Oh.
rolls and the,
Yeah.
oh my gosh. But then
Mhm.
I probably also wouldn't own a Shar-Pei. Speaking of
oh, yeah.
rolls,
yeah, I
I
would
got
not.
that and personality too. sometimes
Yeah.
you don't know.
No, Shar-Peis sometimes are not nice.
We had
Yeah.
a 8-month-old one that nobody could get near.
Yeah.
Mm-hmm.
Like you looked at him and he would lunge at you.
Yeah.
Yeah, I would never own a breed that would need like actual routine like grooming.
Yes, like
Haircuts.
repetitive greening.
Yes,
The
like you
continually
have to
hair
like
growing
take
dogs.
them.
Yeah.
You don't have to take them, but
Yeah, but if you don't.
I like I would never, because I would set the dog up for failure. I would just never do it.
Yeah,
Like
that's
grooming
fair.
is expensive in general. Like actually in finding a good groomer and then having time to take your dog to and from the groomer.
Yeah.
I get my hair cut once every 6 months. You think I'm gonna take my dog every 6 weeks?
Right.
Yeah. Yeah.
No.
I like the appeal of it because they smell so nice.
Oh,
They
yes.
do.
So
They
soft.
Oh
do.
yes, for
Oh.
sure. But I just wouldn't do it.
Yeah. Yeah.
But
No, I think that's fair.
yeah,
Okay, same question, but cats.
I don't know cats that well. I don't want a calico.
I do not.
Calicos
want
are my
a
least favorite.
Savannah.
Oh,
Mm-mm.
No on a
Yeah.
Persian.
Okay.
we all have what we don't.
No on a Persian.
And
Definitely.
why Persian?
Because they got the smushed faces and the horrible eyes.
Like they
Yeah.
get gunky. And
They
Yeah.
touch you with their eyeballs and they
Ugh.
smell you.
Ugh. And their faces. Like you can't even do any dental work to them. They're like,
yeah.
right? That's how they look.
Great
They're like-
representation.
I would
Oh,
say
yeah.
Savannah because they scary, man. Whether you got
Okay.
a pure or half, whatever they
It's
call 'em.
literally a wild cat.
It's a
It's literally a
wild
wild
cat.
cat.
They're
Yes.
beautiful. Don't
oh,
get
they're
me wrong.
gorgeous.
If we're not going off of looks, this one I'm going off of personality.
Yeah.
Like, mm-mm.
They're scary.
I like the
Mm-mm.
Bengal cats.
Ooh, Bengals are so beautiful.
They're pretty.
Mhm. I
Aren't
think
they
aren't
kinda-
they more domesticated than a Savannah?
Yeah,
Anyway?
Yes.
I think so. I think they're pretty nice.
I feel like the
mean,
Bengals we've met though at the clinic are kind
Again, we're
sketchy.
in the stressful situation.
of. I
Yeah,
know.
yeah.
So we can't really base it. Yeah.
Would you
okay.
ever own a Maine Coon?
Yes.
Yes.
Yeah, they're like dogs.
Yes.
Okay. So yeah. So I would not want a calico. Well, but see, that's based off of the clinic.
Yeah,
But calicos are just known for being
yeah.
beaches.
Princesses.
Yeah.
Princesses with attitudes.
Oh wait, I know what I wouldn't have actually.
You
What?
would not
An
have.
orange male cat.
Oh. Okay.
You would not own an orange male cat?
No.
Why?
Because
I love them.
Orange cats, they're cool, but like they're psychopaths, and then they block.
They are
And
not.
then they block.
None of my orange cats have ever done that.
Okay.
But they're indoor outdoor. So
Yeah. so they have outdoors. So they don't have to be so stressed.
Stress. Yeah, they don't have the stress.
Okay, I would have an
situation.
orange cat if he was outdoor only.
Okay.
How about that?
I think I would pick for breed a Siberian.
Oh, yeah. They're cool.
I really love, I love long hair, obviously. That, well, or ragdoll. But I think based off personality, again, going back to what we see in the clinic, I would prefer Siberian. They're
Yeah.
usually more chill.
Yeah.
I would
Okay.
have a Maine Coon or a Russian Blue.
Okay. Interesting.
Yeah.
I think I just like blue gray animals too.
Yeah,
Yes.
so that's fair.
Okay.
Wait, did you say your favorite? You didn't say your favorite. You just said no Persian.
Yeah, I thought I did. No, I didn't.
Oh,
You said you
Bengal.
like
You
orange
said
cat.
Bengal.
Oh,
You're right.
Bengal.
You
Okay.
I
said
would
Bengal.
definitely own an orange male cat. Okay, next one.
Hi, VRT. I am a current vet tech student in my 40s who has very recently returned to the industry after a 14-year hiatus staying at home raising my human babies. I spent 4 years right out of non-vet med college as a vet assistant and knew since I was a tiny kiddo that I was meant to be in vet med. I always knew I'd return to vet med one day after kids, and now that my babies aren't so little anymore, I am finally back and doing what I love. It has been challenging, however, as many drugs and protocols I was familiar with have fallen out of favor in lieu of new ones. So relearning all of that has been a challenge I accept with vigor. I greatly appreciate your personal and professional insight into all things vet med, your willingness to look at all things from different angles, and the compassion you clearly demonstrate in your case studies. My favorite episode was the mailbag episode, so I vote for it to be a regular thing. My question today is, the clinic I currently work at is RVT owned, and my boss is incredible. She is passionate about gold standard care and always willing to learn new things while sharing that knowledge with the rest of her staff. I try to tell her directly how much I appreciate her and all she does, while also attempting to be a positive reflection of her in the clinic. Are there any ways specifically in which I can support her in her clinic's mission? I am witnessing in real time some of the complexities of an RVT-owned clinic in regard to the doctor-RVT boss dynamic specifically, and frankly, I don't know how she navigates it. Thank you again for all you guys do, Amanda.
Cool question.
Yeah, that's really good.
Congratulations on getting back into it.
Yes, that's
That's fun.
exciting.
That is fun, fun, fun.
I think
I wonder how that dynamic works.
I would think if you respect authority
Yeah.
and your boss, you just
That's
treat him
true.
like a person.
Yeah, I was going to say, no matter what, you respect the position, right?
Yeah.
So, I
Mhm.
mean, and I think that the person who's owning the practice has a genuine interest in running a business. Otherwise, why would you put yourself in that position?
True. Yeah.
You know, and it sounds like she really is trying to drive improvements and gold
Yeah.
standard care and things like that, you know?
Yeah.
I could see where you could have some personalities of doctors where they're like,
Well, yeah, if you get the wrong person in that
what
position
do
is
you
what I was
think?
saying.
You know,
right?
you don't know as much as me kind of
Mhm.
personality,
Yeah.
you know?
Yeah.
But I'm sure, you know, the thing you can do if there isn't already someone in a position of like, you know, working with a veterinarian to, and I'm sure she already has this, that is kind of quasi like a medical director that is handling veterinary medicine topics, you know, the things that veterinarians would be deciding
Mhm.
as far as like policies and procedures, and then working with that RVT in terms of in a leadership position, the
Yeah.
person who owns the practice, you know what I mean? And like trying to grow it together.
Sure.
Yeah.
But what would you guys suggest that she do to help? Do you think
I
that's what
think-
she's asking? Like, what would you specifically do to help
Show
the owner?
appreciation. I thought like what ways can I do to show my appreciation for her, not necessarily help her do her job.
Yeah.
I honestly think when you just said you try to represent and support the clinic and the mission and respect, I
That's
think
what I was gonna
respect
say.
is the best thing you can do.
Mhm.
Like
Mhm.
you respect her, or obviously you wouldn't be there if you didn't respect or agree with the core beliefs. Maybe you would be, I don't know. But by doing that and then living them out, I think that's all a boss really could ask for
Yes.
as well. So that includes standing up for certain situations, like if gossip gets out of control, or if you are just trying to see the other side of her decision and
Yeah.
trying to, even if you don't necessarily agree with that's how you would do it, you just try to respect it. It's just respect.
Yeah.
Yes, that's what I think.
Yeah. I mean, I think supporting the decision making,
Mm-hmm.
you know, because anything that you can do to make your boss's job easier then is really what you're chasing. So from a HR perspective, so anything you can do to that accomplishes that, then
Yes.
the more
Mhm.
you're going to be able to be trusted and then also given more duties
Mhm.
because that gives you a longer leash, if you will. It's interesting to me that in certain situations you see people offer up random acts of defiance. And I don't know if they intentionally are doing it or unintentionally doing it, but you have people like, say, these veterinarians who maybe are able to lead down
Mhm.
to their staff, but can't lead up. And one of the things that you can see happen is that the veterinarians may be undermining her positions within, you know, like maybe policy positions or
Yeah.
whatnot. Like, yeah, that's what you say, but I'm not going to do that. I'm going to do this anyway.
Mhm.
You know, and not that you are even necessarily verbalizing that as much as your actions displaying it.
Yeah.
And so these random acts of defiance then degrade, you know, the culture over time or whatever. And it's interesting that people do that, but whatever. So I think to your point, Doug Wall, of like just supporting and
Mhm.
actually following through, you know, basically what this person's asking you to do
Right.
is a great way to show support.
Yeah, I agree. That's what I was going to say. Living the core values that are set by the clinic. Yep.
Mm-hmm.
Hmm.
Yeah.
All right, next one. Kind of random, but I was wondering if y'all plan to release merch. I love the podcast and I listen on my way to and from work. Katie.
Maybe we will.
We did merch for our live show last year.
But we, you know, and it's so weird that this question came about because maybe it was because we were talking about merch from the live show, like when we were at the lake or
Yes.
whatever. And I was like, I really wonder if we should have merch for the roundtable, like where it's just like a hat, a shirt, or whatever.
Yeah, like kind of one option thing. If you
Yeah,
like it, get your size.
Yeah.
And yeah.
Maybe.
Maybe.
We'll think about it.
Put it on the
Do
table.
you want merch, Katie?
Okay, who would buy
It's
merch?
a-
We need to start a poll.
Would
Would you buy merch?
Yeah.
And if so, what kind of merch?
Yes. Do you want? Yeah.
There's so many things.
You want those really comfy, soft T-shirts? I love
Yes.
those.
Yeah, those are great.
Yeah, the
Okay.
ones from our live show are very comfy. Okay.
Okay.
Next
That's
one. Hi, VRT team. I love your podcast and the community you've created along with it. I listen on my way to and from work, walking my dogs, and when doing dentals, LOL. I've always wanted to be a veterinarian, but your recent episodes in vet school were the final push to encourage me to finish up the last of my prereqs and apply in the next year or two. For now, I am a vet tech who works with patients who have inherited bleeding disorders, specifically hemophilia and von Willebrand's disease. Has anyone on your team ever seen or diagnosed a patient with a bleeding disorder? I never saw one when I worked in GP, but know lots of people who have crazy stories of working up those cases. Thank you for making VetMed a brighter place, Emily. Oh,
So
that was
interesting.
so nice.
Yeah, it's cool. She
Yes.
listens to it
Yeah.
during dentals as well.
That's a very interesting career path.
Yeah.
That's fascinating.
It's
Yeah.
very cool.
I had a case where I was concerned about it, so I did the
Yeah,
BMBT or whatever.
Yes.
Mucosal
Membrane
test,
bleeding. I remember that
yeah.
MBT.
Mhm.
That's the only, and it was fine. So that's the only time I've really explored that as
Dud-
a possibility.
I think
Dudley's
Dudley's had a
also-
von Willenbrand. Hasn't she had one?
I've
thought
never
she-
had a von Willebrand,
thought
but
she-
I've been worried about it, like in
Right.
a
I
Doberman.
thought-
I think
yeah.
we went down this
I
path
thought
of-
Dudley had a Doberman who had it. I
I've
could be really
diagnosed
wrong.
macrothrombocytopenia in a cavity.
Yeah.
And we did that because the owners were gung-ho on getting the definitive through some university. I don't remember. Kansas or something. Anyway. But it doesn't really
I don't think
change
I've
my
ever
approach.
diagnosed somebody with hemophilia.
Mm-mm, I have not.
So that would be interesting.
Mm-hmm.
Okay. Maybe we'll report back next episode on hemophilia.
Yeah, I know. I'm like, I'd have to look up
I know.
all
I
the
would need to look
specifics.
up the breed specifics and
Yes.
like the
Yeah.
right.
Yeah, I don't know.
I don't know much about it,
It's not something
but I
that
haven't seen it.
I'm well versed in. That's for sure.
Alrighty. Well, if we did diagnose it, we'd be talking about it too. so.
Okay.
Maybe at some point it'll be a case.
Yeah. Thank you so much for tuning in to another episode of the Veterinary Roundtable. Remember, send in those questions and leave us a review if you enjoyed this episode or a previous one. We'll see you next week for another episode of the Veterinary Roundtable.
Thanks. Bye.
Bye.